Instructions to the psychomotor skills candidate for patient assessment management of trauma. Welcome to the patient assessment management of trauma skill station. In this skill, you will have 10 minutes to perform your assessment and voice treat all conditions and injuries discovered. You should conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to his or her shorts or swimsuit if you feel it necessary. As you progress through this skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example blood pressure, will be given to you only when you ask following demonstration of how you would normally obtain that information in the field. You may assume you have two partners working with you who are trained to your level of care. They will correctly perform the verbal treatments you indicate necessary. I will acknowledge your treatments and may ask you for additional information if clarification is needed. Do you have any questions?
No.
All right, you arrive on scene to find a patient who has fallen approximately 20 feet from a ladder.
Okay. Scene safety be aside, what's my mechanism of injury?
20-foot fall from a ladder.
Okay. How many patients do I have at the scene?
You have one patient.
Okay. I'd like to call for ALS backup at this time, and I'd like my partner to come in and hold inline manual stabilization. So as my partner's coming in and holding C-spine, I'm going to ask for a general impression of the patient.
You have an approximately 30-year-old male who's found supine on the ground.
Okay. As we approach the patient, I want to say, hey sir, you okay?
No response.
Okay. I'd like to elicit a painful response at this time via sternal rub.
He withdraws from pain.
Okay, withdrawals from pain. Okay. I'd like to instruct my partner to go ahead and open the airway using a jaw thrust maneuver, and I'd like to look at the rate, rhythm, and quality of the patient's breathing.
He's breathing 6 times a minute and erratic.
Okay. I'd like to go ahead and measure and insert a appropriately sized OPA. Does he accept?
He does.
Okay. I'd like to go ahead and instruct my partner to ventilate the patient with the BVM attached to oxygen at 15 liters a minute. When she squeezes the BVM, do I see adequate chest rise and fall?
Yes, you do.
Okay. I'd like to confirm lung sounds at this time.
Lung sounds are clear,
Okay.
clear, clear, clear.
Okay. All right. She's going to continue to ventilate the patient. I'd like to check a pulse, carotid, and radial for rate, rhythm, and quality.
Pulse rate is 66 with bounding pulses.
Okay. I'd like to assess the skin temp, color, condition.
Patient is warm and dry.
Okay. And I'd also like to scan the body for major bleeding.
No major bleeding noted.
Okay. Nothing's indicated for shock management at this time. This patient has a Glasgow coma score of 6. They are a critical patient. We want to be off the scene in 10 minutes. At this time, I'm going to initiate my rapid trauma assessment. So before I do a rapid secondary assessment, is there anybody on the scene that can provide a sample history of this patient?
There's not.
Okay. I'd like to go ahead and expose the patient prior to beginning the rapid secondary assessment. I want to start at the head, forehead, scalp, around his head, checking for decap BTLS.
None noted.
Okay. I want to check his pupils.
Pupils are unequal.
Okay. I want to check the ears, the nose, the mouth for fluid secretions.
None noted.
Palpate his cheeks, coming down to his chin, mandible, facial structures.
Stable.
Okay. I want to palpate the back of his neck for decap BTLS.
None noted.
Okay. I want to look for JVD,
None noted.
tracheal deviation,
None noted.
any sub-Q air.
None noted.
Okay. I want to measure and place an appropriately sized C-collar. When that's on, I want to come down and I want to palpate the clavicles.
They're stable.
Okay. Palpate the sternum.
Stable.
Okay. Palpate the sides of the ribs. Do I feel any decap BTLS?
You do not.
Do I have equal expansion when she squeezes the BVM and ventilates the patient?
Yes, you do.
Okay. I'd like to reassess lung sounds at this time.
Lung sounds are clear, 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 clear.
Okay. All right. I want to come down and I want to assess the abdomen.
The abdomen is soft.
Soft and non-tender in all 4 quadrants. Okay. I'd like to come down and inspect the pelvis. I'd like to press in and down for stability.
Pelvis is stable.
Okay. I'd like to assess the genitalia
Nothing
for
noted.
injuries. Okay. Coming down the right leg here, I want to assess for decap BTLS coming down the leg.
You notice obvious angulation of the right lower leg.
Okay. Any major bleeding noted?
No.
Okay. I'm going to note that and move on. Come down to the right foot. I want to check for pulse.
Pulse is present.
Okay. I want to provide a painful response to see if the patient consents or withdrawal of that pain.
No response.
Okay. I want to check the same thing down the right side of the leg. I want to come down here checking for decap BTLS.
None noted.
Okay. I want to check for a pulse.
Pulse present.
Okay. Well, again, I want to provide a painful response to see if the patient consents or withdrawal to that.
No response.
Okay. I want to come up to the right arm, and I want to start at the shoulder, coming all the way down here, checking decap BTLS down the right arm.
None noted.
Okay. I want to check for pulse.
Pulse present.
Provide a painful response to see if the patient consents or withdrawal from that.
No response.
Okay. I want to move around to the other side and check the left arm at this time, starting at the shoulder, coming down, checking for decap BTLS.
None noted.
Okay. I'd like to check a pulse.
Pulse present.
I'd like to provide a painful response, see if the patient consents or withdrawal to that stimulus. Okay. I'd like to go ahead and roll the patient at this time. Okay, and we are going to go ahead and roll the patient on my C-spine person's count.
On 3, 1, 2, 3.
Okay, I'm going to roll the patient up. I'd like to go ahead and check the thoracic spine, down through the lumbar spine, checking the back for decap BTLS.
Nothing noted.
Okay, I'd like to check the buttocks for incontinence of GI or GU.
None noted.
Assess the back of the legs for any injuries.
Nothing
Okay,
noted.
we're going to place a backboard behind the patient, and on my C-spine person's count, we're going to roll the patient safely onto that board.
On 3, 1, 2, 3.
All right. At this time, I want to go ahead and prepare my patient for transport. We're going to cover them with a blanket, get straps, and then we're going to go ahead and safely move them to the truck. We're in the back of the truck. We're on the way to the hospital, providing emergent transport to a level 1 trauma center. I want to go ahead and get a set of baseline vitals at this time. I'd like to take a blood pressure.
Blood pressure is 170/100.
Okay. All right. I'd like to come back and reassess my airway. Am I still getting adequate chest rise and fall with each of the ventilations, the OPA insertion and the ventilations?
Yes.
Okay. I'd like to reassess lung sounds at this time.
Lung sounds are clear, 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 clear.
Okay. I'd like to reassess a heart rate again. Just a nice reassessment.
Pulse rate is 66 and bounding.
Okay. At this time, we want to continue transport this patient to a level 1 trauma center. We want to make sure that they remain covered with a blanket. I'm going to come back and bandage and splint the right lower leg as time permits. We're going to monitor our vital signs every 5 minutes, call in a report to the hospital, provide a patient report, and our ETA.